Few people would disagree that electronic medical records would be an improvement over the system we now have. We need to have better communication amongst doctors, between doctors and patients, and certainly between insurance companies and pharmacies than we do at the present time. But things have gotten complicated, and now running a practice with all the kinds of problems that we have has become more challenging than ever. We have so much time to spend on insurance forms and filling them out that it takes time away from our patients, and the listening and the caring doesn't get done. In a 15-minute visit, it may take 5 minutes of those precious 15 minutes just to deal with the paperwork that we have to find out whether or not our patients are going to have their services covered. We also have problems with communication between doctors and patients. We don't have access to our doctors, and oftentimes it takes a week or sometimes even a month to see your physician because of scheduling problems. We don't have an email system that is widely used between doctors and patients that would solve some of this problem. We also have a problem with cost. We have an issue where we're spending more money than any country in the world, but in actuality, an awful lot of people can't afford health care, and that's why the Affordable Care Act actually was just put into practice. We also have problems coordinating care. Doctors often don't get reports from their specialists or old records when someone's admitted to the hospital because we don't have access to them in a timely way. Electronic medical records would certainly help that immensely. Patients often come to doctors to make visits because of getting a prescription refill. This could be done electronically and is being done by a small percentage of doctors, but that needs to grow. There are also questions that patients have that they would like to be able to connect with their doctors about that is not always the easiest way to accomplish by seeing your doctor because it's hard to get in or it's inconvenient. It's good for follow-up of things like hypertension or blood sugar levels or things of that sort because they can just be emailed back and forth and you can stay on top of things a lot easier. So we have a system that's oriented basically in a clumsy sort of way. It's oftentimes designed to help the staff more than it's designed to help the patients in terms of access. So electronic medical records would do wonderful here. And I think that the management should be shifted so that it's more convenient for patients. The real question that comes to my mind is, should these be national guidelines? Should they be state guidelines? Should they be local guidelines? What we don't need is Big Brother looking over our shoulder as physicians. I like to be able to practice where every patient is different and unique, and their needs accordingly unique. A one-size-fits-all program that gets followed by Big Brother because you have now electronic medical records that are accessible at the national level means that now you may not get your patient to be covered by the insurance, either a national insurance or by even private insurances, if they don't agree with what you're doing in terms of practice. It also keeps us in the status quo, so that we can't do new cutting-edge therapies, even if they're safe and effective, even as off-label use, because of the economic restrictions that develop. So I have a great fear of too much government in medicine, and yet at the same time, the government's in a position where it can do the most to try and help us to have electronic medical records that work. So we have some thinking to do. Our system doesn't work. And in a study that was done and published in the journal Health Affairs in November 2012, 8,500 primary care doctors were surveyed, and basically about 15% of them thought that the healthcare system that we have now is one that they think is ideal. So we have to do something to find a compromise between having medical records and still having the ability to keep the information private and be able to have the flexibility of being able to treat our patients the way we think is the best without having to worry about Big Brother looking over our shoulder.